A new day. That was Dallas County Judge Jenkins just moments ago speaking about the second healthcare worker infected in Dallas with Ebola. Officials already have begun the daunting task of what is being called contact tracing, locating all people, any people who have come in contact with that healthcare worker. So with precious hours and days having passed, how many people could be in jeopardy? And how can officials find everyone who may be impacted before the disease spreads any further? Joined again live by CNN medical analyst Dr. Alexander Van Tulleken. We call you Zand with all respect in the world. Let's talk about this contract tracing. Why don't we set up kind of like 3 scenarios? The first one being a patient that tests positive for Ebola, shows up sick and has the symptoms, comes to the hospital, is tested. Then the work begins not only on his medical treatment, but on tracing every person they've come through contact with.
Yeah. So if we imagine this red figure represents someone who's been in contact with, for instance, someone like Thomas Eric Duncan or Nina Pham, who's had Ebola. They develop symptoms, and so they are now positive for Ebola, so now we need to contact trace every single person.
And we mean everybody.
So the first thing to do is say, since you developed symptoms and therefore became contagious, you could infect other people, where have you been?
What'd you do?
And what have you done? Now, if you imagine, the average incubation period's 6 days. You've got, after that, once you're symptomatic, you might, before you go to hospital, might be a few days. If you ask me what I've been doing for the last 3 days, it's going to be quite difficult to remember.
It is. All the places that you've gone, any errands you have done, any stop you made at an ATM, et cetera, et cetera. These are all things that they really have to pay attention to.
And what we're using is the 3-foot rule. And the 3-foot rule seems to be that you can't be 3 foot's about arm's length.
Okay,
and so it's quite easy. There's a big difference between arm's length and not arm's length. So if you're interacting with someone at a cash register, something like that, you're closer than 3 feet. So all those people have got to be contacted. And then the question is, what do you do with them then? Well, you need to make sure that you can stay in touch with them. They need information that they've been exposed, and they need information about who to contact if they develop symptoms and what symptoms to develop.
And again, you're relying on human ability, memory, honesty, and isn't even nefarious, but you just might not remember.
Let's not forget. Exactly. So first of all, and the other thing is, it's very hard not to miss anyone. Okay. Absolutely. So you've got to be a real detective here. I mean, you're going to be using email, telephone, Facebook, personal information. You may have to go, if it's a gas station, you've got to go back to the gas station and just say who was on that day, at that time, who served them, which register you at. Very, very hard to do. So a detailed questionnaire is where we start.
And again, it's really key in somebody like, we know that Nina Pham, she knew right away, this is a concern because I've been around Ebola patients, and she quickly went to, let me swipe this to the next scenario. She quickly went to the hospital and was isolated. Let's talk about the second scenario, is when you have an Ebola patient, this is one of the contacts. So if somebody in the network of contacts that, for example, Duncan or Nina Pham, the nurse, would have come in contact with, then what?
So the ideal is you get someone who displays no symptoms for 21 days.
I'm feeling fine.
We can stop monitoring you, and that's okay. But what we've seen is that isn't really good enough anymore. So we used to say, okay, all right, we'll watch you for 21 days. Now that we've got these 2 healthcare workers infected, we have to say, this is America. We should be doing serial blood tests on them, and they should be at home. They probably don't have to be in a hospital room, positive pressure room, anything like that.
But
they
just alone in their
home. With family, with pets, that's okay. But somewhere where they're not out in contact with lots of other people. So you limit that as much as possible.
And the first red flag is
the first red flag is fever or feeling unwell. I mean, this is a virus that presents. Your body's only got a few ways of getting ill, if you like. And a fever's usually an early manifestation of your immune system getting going. But feeling unwell, you may not notice a fever, maybe you're out in the cold, something like that, it could be a variety of unwell symptoms.
And the key is this 21 days again, because that's sort of the outside that we're looking at. Now, here is the one, and again, Zen and I have been really cautious. We don't want to over-panic people. We want to have urgency when we talk about this. The question mark is, what if we miss someone? What if in those contacts there's somebody who came within the 3 feet of a sick patient with symptoms? What if we missed one of those points of contact? And that's the concern.
So the only way of addressing that is doing what we're doing now, which is talking about it in the press, in the media, and making sure the public are generally informed. So if you are in the region, and this is the really difficult bit, as we say at the moment, if you're in the region where there's been someone with Ebola and you develop symptoms, should you worry and how should you seek care? And at the moment we say contact your healthcare provider. Now, That's a tricky thing to do.
Right.
Go to a hospital, you potentially expose more people. But
and
we
see
don't
they're on the front line.
At the moment, we do not have an Ebola hotline where you can phone and say, I was in the region, I worked at that gas station, I think I've seen that guy who's sick come in. We don't have any of those systems in place. This is one of the criticisms we've offered of the CDC. But at the moment, I think it's reasonable to say, if you're concerned you have symptoms, speak to your healthcare provider.
You've been doing a great job for us today.
Thanks
I'll
very
shake your
much.
hand and I'll come in within 3 feet of you. Thank you so much for that, Dr. Tulleken. Allison, to you.
All right, thanks.